Thank you very much, Afsa, and thank you, colleagues and friends, for being here with us today. This is the picture that was taken when, on 13 June last year, during the International Labour Conference that gathered some 5,000 delegates, employees, workers, governments, we launched this voluntary counseling and testing at work initiative. Why did we launch such an initiative? Because, and UNAIDS reminded us of the hard facts, is that half of people living with HIV still are not aware of their status. If we think a second that 90% of the 35.5 million people who live with HIV today are either working or linked to the world of work, we then understand why it is important to try to have a common initiative from the world of work, something that we can together jointly deliver by the end of next year when we reach the target date of the MDGs. What is this initiative about? The initiative is about reaching 5 million women and men workers with voluntary and confidential HIV counseling and testing by 2015. This initiative is part of a broader campaign that we launched earlier to the launch of this initiative, and these are the pictures of the launch of this campaign. And you could see our Director General, the Director General of WHO, Luis Lores, who is the Deputy Executive Director of UNAIDS. And this is a campaign through which we wanted to have as many possible people telling the world that the world of work is a way through which the AIDS response can be enhanced. And we do have today hundreds of celebrities, young people, people belonging to the cultural world, workers, employers, who tell us what is it that they have to pass on as a message in order to galvanize the world of work around issues relating to end of stigma and discrimination and addressing HIV and AIDS. These are pictures and quotes from this campaign, which are actually passing on very significant messages. Michel Sidibé realized and realizes that the world of work actors are so vital to the AIDS response that if we were able to reach that goal of 5 million workers going through the test, it would really be a significant advance. And our Director General put the emphasis on the need for us to work together in order to crack the zero stigma and discrimination, which, as we all know, is the most difficult zero to crack. What are the key principles? They are embedded in Recommendation 200. VCT has to be voluntary. It has to be confidential. It has to go with counseling, pre-counseling and post-counseling. It has to be connected to treatment because this is actually the end results. There is no need to test if there is no access to treatment. It has to take into consideration elements of equity and gender equality because we do know that women are much more vulnerable to HIV infection than men, and that in the workplace we should look at the various perspectives of the different genders. And it's not only women, as we know there are many more genders, so we have to look at all these issues. And absolutely we need to engage people living with HIV, workers living with HIV. And when we designed this campaign, this initiative, we worked with the global network of people living with HIV, and they did produce guidelines on how to go about VCT, which we are using in our campaign. These are the different elements, the main elements of the strategy that we have been putting in place to undertake our VCT initiative in the different countries. It is important that we focus on enterprises or workplaces that already do have programs, where there is an environment, where there are rules, where employers and staff are already aware and have a certain level of knowledge of HIV and AIDS issues. We also wanted to focus on high prevalence areas and key economic sectors because, as you see, reaching 5 million, we really need to go where the numbers are. What we also had to do at the beginning is to map the VCT providers and ART centers in order to know where they are located so that our interventions are more promising. Building partnerships, this is certainly something I don't need to insist on, with providers, following national protocols, and also with national AIDS programs. And I'm glad that there are representatives of national AIDS programs in this room. We've been working hand in hand with them, including the ILO constituents, of course. Communication and advocacy is key. Some of the speakers here will certainly tell you how they went about it, and then I think this will be the time for us to realize that communication and advocacy plays a very important role. Capacity building is still needed in order to ensure that the voluntary counseling and testing is being done according to the rules, according to the main principles that are embedded in Recommendation 200. And where we still have a little bit of challenge, which we realize is important, is to make sure that we have reliable monitoring and evaluation systems in place. So far, these are the countries that have been targeted, that have been part of this initiative. And the figures are they are today is that we've been able to reach out to over 1 million workers, and workers tested were around 191,220. I must say that these figures date back from March. That is, we collect the figures every quarter, and we are about to collect the new figures. And we believe that we are going to step up very rapidly, and I'm going to explain that later. What is it that we realized works? What are the elements that really helped us think that we should be looking at these different factors? Linking with national AIDS plans, national initiatives is certainly the way to go about it. Because when we talk about the AIDS response through the world of work, the idea is that the AIDS response through the world of work should be part and parcel of the national response. It's not an issue of having a parallel response that will be coming from the world of work and the national response. So at one point, we need to be able to link up the two. More and more now, testing under a broader approach, which is the wellness approach, where you test not only HIV, but you test also diabetes, you test blood pressure, and other health conditions, is more successful because it's less stigmatizing. Because any worker that walks into this center can be there for anything, including HIV. Whereas if it is only for HIV, then we are in colleagues and workers do not want to go further. One thing that we have learned is that trade unions have the capacity to mobilize. And I'm going to give you a few examples. In Cameroon, we were able to test 15,000 workers in less than a week. In Nigeria, almost 15,000 workers in less than 3 days. We're partnering now with SAC2, and we have a figure of around 23,000, but this is only figures for 3 months. So there is a lot of potential. Offering HIV testing within a broader package of health. I mentioned that is important. And it is also one way maybe of just making sure that this goes further is to include the voluntary testing in annual medical exams. Challenges. There are challenges. It is difficult to track workplace testing results in national reporting systems. We generally have national reporting systems, and the initiatives that are being undertaken by the labor movement generally doesn't feed in systematically into the reporting system at national level. VCT service providers are not always able or even willing to meet large demands, and there is a need for us actually to strengthen our partnerships with all these different partners and with other world of work actors in order to make sure that we reach this goal. The next steps are the following. You may say that the figures we've reached so far are small. But we have noticed that it takes a lot of time before the process starts and scales up. I just gave you the few figures on some of the countries. For example, it took Cameroon something like 10 months preparations, and in 9 days we were able to have 15,000 workers tested. Now that all these countries that are on the map are now on the moving stage, we do expect to have larger figures when we report next time. We also need to expand to more countries, and we do have countries that are already doing some preparatory work, and also to expand our partnerships. And more importantly, we need to mobilize more resources. We were able to mobilize resources with some donors. Recently, the Australian aid supported us in Indonesia, and there are other countries where some donor money was put at our disposal in order to assist. One thing maybe I'd like to say before I close up is we do not, as ILO, have the pretension to do it on our own. Our role is to facilitate the efforts that are being undertaken at country level by the labor movement, together with the employers and the governments and the National AIDS Commission and the networks of people living with HIV and other actors. So we are playing the role of a facilitator here. And I would like maybe to end up by this plea. There is a lot of potential. The labor movement can really reach out this goal. Of course, we do have only a few months to go, but the way it is speeding up, we are still confident that we can make this joint significant contribution of 5 million men, women workers aware of their status by the end of the MDG target date. Thank you.